Advent, founder of Advent, and host of our Adventing show, all things about ENT, the world in general, Advent in specific. And I am joined by Dr. Ethan Handler. How you doing?
I'm doing well. Happy to be here, and as always, and enjoying this warm weather.
Yeah, it's very warm. It's super duper warm right now, but yeah, summer is here. And we are, big news at Advent, a couple big news. One piece of big news is we have moved our admin space, which, I don't know if the rest of the world cares about, but for us, it's a big deal. Yeah. So
yeah. No, I was going to say that, I when I joined the practice, 4 years ago, we were kind of a certain size, and you forget when you're kind of, when you're in the midst of your clinical work, kind of how the company might grow kind of around you as we get bigger. And so kind of seeing the first step for admin and then seeing this next admin space, you realize that we're expanding and growing, and it's fun and reaching a lot of people. So I think it's pretty cool.
Yeah. No, it's the first time for us that we've had administrative space that's been separate from clinical space. So it's going to take some getting used to it for us. And but yeah, it'll be a good thing. And it really is. I mean, we moved that space to kind of prepare us for continued growth. And part of that growth, as we get bigger and bigger, part of it is sort of kind of making sure we're kind of all staying on the same page. So I think we were talking earlier about the conference rooms at our new admin space, which have specific names for specific individuals, and those individuals sort of embody our core values, was kind of the mindset that came along with those things. So yeah, what any names on the list? I don't know if we have to run through all the names. I guess we could, but any names on that list that are of note?
I think the Britney Spears room is pretty cool.
Yes, that's our late '90s themed room.
Yeah, Christina Aguilera and Maroon 5, those are kind of all hitting the major spots for us. No, certainly the Steve Jobs room is pretty cool. He's such a fascinating character and an interesting story. So I loved his biography that was written. Yep. And then hitting, Churchill. I mean, the big dog. So that's a big conference room. Any that have a special place in your heart in particular?
No, they all. I mean, I kind of was at the center of putting that list together. So they're kind of they all have different angles on things. So, but yeah, I mean, Churchill is our main kind of war room over the new space, our biggest conference room, and that's where those big decisions, tend to happen. But yeah, Disney, Muhammad Ali. I mean, there's sort of these names mean something, but I'd say for us at Advent, they all kind of embody some aspect of our values. Actually, like Ali specifically, I can go on each one, so we're not going to spend all the time going over each conference room or each person, but Ali in particular. I mean, this is, let me go this way. I'd say I think of Muhammad Ali for his sense of humor and wit and confidence, and those are all things that I think are really worthy. But I think the weird warped thing with him is he was a badass boxer who would beat your butt kind of a thing, but I don't know that many people think of him that way. He was, he's the heavyweight champion of the world, and yet nowadays when we think of Muhammad Ali, at least I do, I think of him in non-boxing terms, which is a kind of an interesting dynamic. So I think that's where he embodies our core value of sustainability, and specifically, kind of having a sense of humor, versus many other values he could have sort of championed. So anyway, I think it's interesting. I would say we put a lot of thought into everything, including some of those things. And as we continue to get bigger, for us as a company, it's going to be important, like I was saying, is for us to kind of maintain the same playbook and make sure we're playing with the same values and those sorts of things. The other big news at Advent is on June 1st, we are opening our latest clinic, which is in Appleton, Wisconsin. So that's a big deal, and big deal near and dear to me. My wife Gwen, who's a co-founder here at Advent, she born and raised up in the Fox Valley, so it's something that's been on our short to-do list to get a clinic up there, and we're actually making it happen, which is good. So you have no Appleton fondness whatsoever. You've never been to Appleton, right?
That is not true. So, quick little anecdote here, a little story. So I went to medical school here at the Medical College of Wisconsin, which was my first foray into living in this area. And so I only knew of the Medical College of Wisconsin because my dad happened to be living in Fond du Lac. So he was a radiologist at St. Agnes Hospital there. And he'd buy all his cars from Appleton, from a Volvo dealership there, Bergstrom, which apparently owns pretty much the majority of car dealerships kind of in the state. And so we would go to Appleton, and there was a restaurant that we'd have like a lunch buffet at every time that we go there. So I was in town. It was always a trip to Appleton. And it was an Indian restaurant that had a great lunch buffet. So that's how I know Appleton.
Cool. Indians, dots, not feathers.
Red dot, yes.
Just
I haven't been to another restaurant, but you may know of some that I don't.
Okay. No, that's cool. Yeah. And you'll be working up in Appleton for a bit, correct?
I will be. Yeah, as we kind of finish our physician search and obviously get somebody trained and onboarded and stationed there long term. I will be helping to cover that gap.
Excellent. And you'll be partaking in the Indian buffets up there probably on a
weekly
basis. So
you betcha. Actually, yeah, for sure.
That's good. That's good. Yeah, today I think there's many things we could cover. There was an article in Wall Street Journal this weekend. I think it was the Saturday Journal that was talking about breathing, and I guess it's an article that's a skinny down version of a book that I think has just come out, which talks about breathing, which is near and dear to our hearts here at Advent, because that's actually all that we do. I think, and I think the article is poignant for in a couple of different angles, but I think starting out at the very beginning of that concept, when people think of breathing or hear the word breathing, I think everybody just sort of jumps to the lungs, which might be rightfully so. And a lot of this article does talk about the lungs and the importance of that part of the breathing. But obviously, in order to get air to your lungs, in order for your lungs to work, the air has to get there to begin with. And the only way it's going to be able to get there is through your nose, ideally, or your mouth, less ideally. And so those are the areas that we deal with exclusively. We deal with the nose and throat. And so the intake of your airway system is coming through our wheelhouse. And many, 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 many people are built with equipment that doesn't work, with noses that don't work, with throats that don't work. And it impacts them greatly. And so, I think one of the first kind of fundamental takes on this article was the importance of breathing and really looking at the fact that for those folks that have the best chance for a long life, you can look at multiple factors. You can look at genetics and diet and lifestyle and this and that. But the thing that really, really has the most direct correlation to living a long and healthy life is really your breathing capacity, your lung capacity. So any thoughts, or was that surprising information to you?
No, I mean, I felt like that was, well, I guess when it looked at some of the studies that kind of just confirmed that, and it seems such a simple concept, although it's lost on pretty much everyone, at least who's kind of walking around taking breathing for granted, right? And I think the first paragraph of that article touched on that people just kind of assume it's something that you do as a byproduct of living, as opposed to being the major player in having a long life, right? So right. It's refocusing people on the importance of breathing and what that means for us, versus just something that we do and get by with.
Right. Which, I mean, it goes both ways, because I think if you're struggling to breathe, then that's the only time you think about breathing. And if you're not struggling to breathe, you don't generally think about it. But then the flip side is most of us don't breathe properly, because you're not putting conscious thought into it. And so there's a big wave of thought coming into play these days, really surrounding meditation and mindfulness and those sorts of things. And every meditative practice I've ever seen or heard of focuses your attention on your breathing and focuses on various aspects of that, generally longer, deep breathing, which is actually what this article is talking about, is sort of long, deep breaths are good, and short, shallow breaths are bad. And the way to train yourself to breathe, those long, deep breaths is it actually takes training. It's not something that comes natural. Generally, I mean, breathing comes natural because it's the foundation of life. But it's most of us breathe, much more shallowly than we should, and much more quickly than we should. And there's a feedback loop there. And so if you're breathing properly, there's a calming part of that. I didn't design, us. I didn't design the equipment. I just sort of know my personal equipment is if I'm under stress or anxious, then I'm breathing shallow and quick, and that's not a healthy way to do that. And so if I want to break that cycle, if I want to break a mental cycle of anxiety, what I can do is I can concentrate on my breathing, and you focus on the physical to train your mental to get there, and you focus to yourself to say, oh, well, I'm breathing really shallow here. Let me take a nice deep breath, slow breath, and I'm going to repeat that. And then what you find is when you focus on the physical, the mental follows, and then vice versa. And so this isn't meant to be kind of, spiritual mumbo jumbo. It's really meant to be real, really as animals. If we're breathing properly, there's a mind and body feedback loop, which is good conceptually, but then from a proof of effect is if you're breathing properly and you're doing it over time, then you live your longest and best life.
Right. Yeah. And I think it also touched on so many different elements of this in that short article that obviously, reading the book is going to be pretty interesting. And it just came out, I think, yesterday or whatever it is. But, it talks about, okay, in the current situation with COVID, and there's a lot of people, anxiety and mental health that has spiked, and just other issues, is that the importance of breathing when one is anxious. And right now we're in a perfect climate to, deploy that tactic. And then also, the history there that it for thousands of years, people have understood and written about the importance of breathing through your nose versus mouth breathing, and it was considered bad breathing when you breathe through your mouth. And so, and then just also touching on kind of the changes to the face. And like humans, it said we're the only kind of creatures where our teeth, as originally designed, don't fit in our mouths anymore. Our mouths have kind of gotten smaller, our nasal passages have gotten smaller. And anyway, lots of topics to dive into, but.
Right. Well, I think that was the other kind of part of the article. I mean, the article was good. And I mean, again, it's just an excerpt from the greater book, which I'm assuming will be good as well. But part of what that the author talks about in the article is the concept. And I think he went through an experiment on his own, which is he had an ENT plug his nose up, plugged it up. I forget. I think it was for like 10 days or so.
Yeah.
Which, if you want to make somebody miserable, I say this all the time, and this was the proof positive of this author did what I say to do. If you want to make somebody miserable, is you plug their nose, and you'll take if somebody's nose was working and you plug their nose, you're going to make that person miserable. And they don't even know how miserable they're going to be because, 30 seconds of that is annoying. A minute, a little bit more. You go days and days. I can't imagine.
I couldn't imagine.
It would be, it's unbearable. And literally, they were tracking some biological data on the author, and he went from not having sleep apnea to having sleep apnea. He went from normal blood pressure to high blood pressure. He
snoring like crazy.
All those things that we talk about commonly, routinely. He experienced going from not having those things there to having those things there. And, flip that around, and I'd say, most of the patients that we see are walking around in lifelong versions of that guy's experiment. They've had lifelong issues with nasal obstruction, and they don't even know it. A lot of people don't know it. And I say this oftentimes too, but it's true, is most of our patients don't know how bad they have it until we fix them. And we get them breathing the way that they're supposed to be breathing. And many times it's for the first time in forever. And so, this author did it for, was normal, miserable for 10 days, took the plugs out, unwound from that, got back to his normal existence. And so he knew what was normal. He knew what was not normal when he was in it, and he was able to get back to normal. Our patients, many of them never know normal. Don't understand the impact of the nose and how impactful it is. both from a nose standpoint, as well as just a breathing standpoint, as well as a sleeping standpoint. And so this author gave himself sleep apnea by plugging his nose up. Our patients, many of our patients, have given their bodies have given themselves or forced themselves into sleep apnea because their noses aren't working. And our first step, if somebody's nose isn't working, is to get their nose working. And so, again, if you have sleep apnea, that's coming from your throat. And so when we fix your nose, we haven't fixed your throat, and we can do that as a separate measure. But I'd say fundamentally, and I think what we do falls right in the crosshairs of what this author is talking about, is that your airway starts with the nose, and either your nose is working properly or it's not. If it's not working properly, let's get it working properly anatomically, and then we'll start we'll start moving beyond that. And really the reality is the rest of the world in the medical community doesn't start with that premise and doesn't start with that fundamental step, and therefore they're always sort of a step behind the game. And I'd say, it's kind of your choice as a patient, and it's our choice as a practitioner. I'd rather have my patients be a step ahead versus a step behind, and I'd rather approach their issues with that mindset, and that's how we do it. And it does, it's something that works because we see it before our own eyes. But then, books like this, and then there are many articles talking about similar things, but they all come back to those fundamentals, which just never get old. It'll never get old. The emphasis on nasal breathing needs to be shouted from the rooftops, and most people have never heard of it, so we haven't been shouting very well.
Mm-hmm. Well, and at least some literature is starting to come out. Obviously, we do a lot of just kind of branding around this because it's so important. And obviously, we need to connect with patients and help them understand the importance of nasal breathing. And the problem with patients, so in comparison to the author who plugged his nose to try and walk through that experiment of what that felt like, which honestly, even thinking about that gives me a little level of anxiety and wants me to breathe through my nose. Like, I can't imagine not breathing through my nose for a week. Like, that seems horrific. But the majority of our patients, they start here in life, and maybe it's okay, maybe it's not, and then they end up way down here, but it's such usual small increments that they don't see how far they've traveled and how poorly their nose is functioning. And so they get kind of used to it over time, right? Like, people have their own nose and they get used to breathing the way that they do, and they don't know what it's like to breathe well.
Right.
And unfortunately, they haven't fast-tracked that like this author did. And so, we talk to patients a lot here, and we ask a lot of questions about nasal breathing, ones that they never have thought about asking or thinking about. And so, we get them thinking about what it means to breathe through their noses and paying attention to it. And I think it's pretty eye-opening for a lot of people. And then when they're on the back end, one of the best feelings is patients who are happy and feel like it's changed their lives, and I've experienced it personally. I've had these procedures done. You've had work done. Like, I know what it's like to breathe like crap, and I couldn't tolerate it for more than like a few months, and it was partially blocked. It can be life changing.
Yeah, it is, and I think if we potentially, how do you say this? Because we're such big champions for the nose and nasal breathing in a world where nobody else, not many folks in medicine champion the nose. Even folks in our own ENT community, I think, don't do the job that we should do. Like, nobody champions the nose as it ought to. We're trying to do that as a practice, and we will do that because it's the right thing to do. As we've talked about previously, there are many dentists around that have begun to understand the impact of this, and they tend to be more champions for the nose and in nasal breathing than ENTs and allergists, which is insane to me. Not that they shouldn't be, but it's just that it's sitting in our court. And as a specialty, I think the thing that gets me, it's hard to get me frustrated, but I'd say that what will get me frustrated, and it happens all the time, is if I'm seeing a patient who's been previously evaluated elsewhere by an ENT, and this patient is sitting in front of me and their nose obviously isn't working properly, and they've been dismissed elsewhere, and it's sort of the double, maybe it's a triple whammy. The whammy, they have this issue that they've sought treatment for that has been dismissed, and then they feel kind of foolish for even looking into something that maybe this isn't even an issue. And then they come in and we find out, lo and behold, well, it is an issue. And well, we can do something about that. And we can do something about that that's super simple. We could do a 5-minute procedure in the office and take care of this issue. And the proof on whether this is an issue or not is, well, let's find out. Let's, I mean, it's not an experiment. It's because it's a consistent, reliable result, which is you take this person that's been dismissed elsewhere, you identify a problem, you fix that problem, and then you ask that person, how does that feel? And that's kind of what you were just talking about, is the back end of a procedure. And most folks, like the large majority, almost all of our patients in the back end of procedures, feel this overwhelming sense of relief and overwhelming sense of being fixed, fixing what was broken. And for us, it's so simple, and we have the tools to do that in a simple manner. And then it just boggles my mind, and then it frustrates me and annoys me to no end that that person that was dismissed elsewhere shouldn't have been, and with the right tools and the right mindset could have been fixed. And when you do that thing, that again, sometimes it gets diminished as well. I'd say, so we're talking about the nose, about in relation to breathing, and you cannot breathe properly if your nose doesn't work properly, period. And yet sometimes you can sort of diminish what we do as like, oh yeah, you guys just fix noses. And I'd say, yeah, you're right, we fix noses, which is the start of your airway. And that creates a domino effect, a massive domino effect towards health or unhealth. And that's something that, if it's my health, and I've done this with my own nose, and you've done this with your own nose, is if it isn't working, then, and you have the choice, anybody in the right mind will choose to fix that. And I did it, and my life is dramatically better on the back end of getting my nose fixed versus what it was pre that. And, yours is as well. And so I think it's not, it is something that we should be, we should shout it from the rooftops, and we should be unafraid to have people hear it and want to seek out the care that they deserve, because it's more than the nose. Because when you have that nose that's working for you, as back to this article, it really sets you up for a life that you were meant to have, and it has a massive, massive impact. That I think the reason that we stand out from the crowd is wrong here. The crowd is wrong. The crowd who sort of diminishes this as an issue is wrong. And, again, my proof of that, how can you say that, that bluntly? I'd say that bluntly because, again, you take a patient, you put them through our system, and you take that same patient, you put them through the alternative, and results matter. And when we get some of the results that they're looking for, that's the proof right there. Like that's the experiment that should be run. So yeah.
Well, it's validating this. I mean, think about how many patients, like you said, they see even people in our own specialty. And they're told that nothing's wrong or given medications, but don't actually address what the patient knows internally is something's going on here, right? Like something's wrong, and they're seeking care in a specialty that isn't necessarily giving them the care that they deserve and need. And so there's a validation element here that's also important. I mean, it came out today, even in clinic, where a patient's like, so basically she was saying that, so I'm right that I feel this way. And I was like, you're telling me you feel this way. Like you are having this experience, and you're not breathing well. And so, yes, and so there's a validation kind of component here that I think is, equally important for patients to be heard, I guess.
Right. Yeah. And I think back to this article, and maybe just finishing up on this thought is I think back to these fundamentals, which, again, this whole concept of breathing, I mean, obviously it's the breathing is the most important thing. And like, so again, how do I know this? Because you can, if you don't breathe, you die. And if you are down on the side of the road and you're, the ambulance comes up, they're going to follow the ABCs, which is airway, breathing, circulation, in that order. always. Airway is first. The start of your airway is the nose and your throat secondarily. And so airway always comes first. You have to have an airway. If you don't have an airway, you're dead. If you have an airway and you don't breathe, you're dead. If you have an airway and you're breathing and you don't have circulation, you're dead. But all of those things come back to the first, it's that first domino, second domino, third domino, in that order kind of a thing. And so everybody talks. I mean, I think, you need a heart that's beating, and that's really, really important. Everybody that knows about heart disease, knows about strokes, don't want anything to do with those things. And yet that's in my mind, in a way, a tertiary issue to the breathing part of things, meaning it's airway, breathing, circulation, airway, breathing, circulation. And yet we, again, as a specialty, do a poor job of explaining it with clarity and explaining it with tact, and explaining with understanding that those things interrelate with each other and they all come together. So why is it the ABCs? Because if you have an airway that's functioning, okay, that allows you to breathe, and you're breathing, that's a good thing. Circulation, what circulation is doing is taking blood and moving it around your body. Well, why? Because blood is what carries your oxygen. So you need the airway and the breathing to deliver oxygen into your bloodstream, and you need the heart to move that around. So the heart works for the nose at the end of the day, and nobody says that, but it's true. Your heart work. You can't. Your heart doesn't matter if your lungs aren't working and your airway isn't working. It doesn't matter. And so,
that means my wife's specialty and I are even more interrelated.
Absolutely. And it's like, well, I'm not saying your heart's not important. It's not that, but I'd say, I think in the grand scheme of things, it's easy to.
But that's a simple, eloquent way of stating it. I don't mean to interrupt, but I never thought about it in that sense. And I haven't heard you state it in that way or thought about it in that way. But that's what it's doing.
I don't know that I've ever said it that way, because I don't know that it's. I mean, but it is. That's exactly what it's doing. You know what I mean? Like if your heart was pumping unoxygenated blood, well, then you're dead. And so that's what happens if you need the Heimlich maneuver, meaning if you're choking and you're not breathing, your heart's still pumping until you no longer have oxygen in your system, and then your system's shut down and you die. Now, did you die from a heart attack? No, you died from asphyxiation, from, what I mean? It all starts back to the airway. Now, people die from heart attacks, unrelated airway issues, certainly, but their death is because the lack of oxygen throughout their body. You know what I mean? It all comes back to that. You have to breathe to live.
And that article said that the nose, when you breathe through your nose, you deliver a higher percentage and content of oxygen to your lungs, right? So, and the whole idea of the lung is to move oxygen that your airway gets into your bloodstream. And that's the whole complex nature of lungs. And so, the heart does work for the nose. I like it.
So again, part of this is there's 10% in jest and 90% in this is real. This is not joking about it, kind of a thing, because it's so easy. Like I said, noses are easy to dismiss and diminish, and you've got an alternative to a nose because you got your mouth and you got your throat. And I'd say, okay, well, you could do your nose or your mouth or both. In the mouth, that's been proven. Book talks about that reality. The nose is the preferable route to breathe, and that's why you do have a nose. So there's ways to breathe, but those three holes, your two nostrils in the back of your throat, that's all you got. And so if those aren't working, you're not living. It's not happening unless you have some alternative method to make that happen. And so fundamentally, I'd say it does start there. The airway starts with us, meaning, nose and throat. And we are not afraid to own that reality. We're not afraid to state the reality too, which is most people who have issues in these areas have anatomic issues in their nose and throat, meaning those areas aren't working. And so you could do all the things you want. You could use a CPAP machine. You could, take your high blood pressure medication. You could, have your heart replaced. You could go to a cardiac transplant. And those things might be necessary, but if all or any of those things are coming after you, many times, if you look all the way upstream, and we're the most upstream in the airway as you get, you might find some issues there. And if you find those issues, the nice thing is our issues are easy to correct. Like if you got an anatomy issue in your nose, it is so easy for us to correct that issue that it is almost I mean, nothing's too easy in life, but I'd say it's really easy. It's not like, a cardiac bypass or a heart
Right.
transplant or
Right.
like we're talking simple office-based, minute-long procedures that have traumatic lifetime and body-wise impact. There's no joke about that. Like that's real, and it's really,
not to
really.
diminish it, but it's easy for those who have, like we have, you talk about this, we have a lot of reps doing it, right? So I mean, it's also, people also make things look easy that might not be that way from just being good at them and taking time to learn a skill set too. But yes, I mean, relatively speaking to, big bypass surgery or something else, like this ain't as big as that.
No.
From a difficulty standpoint.
Absolutely not. No. So yeah, I mean, I think basically bottom line, and I mean, I will read the book. It just came out, so I'll read it and sort of see if there's more. I'm sure there's more nuances around sort of this breathing. But breathing, I think that at least in the last couple of years, the nice thing is in the lay public, there's been a much, much deeper understanding of the importance of breathing, of sleep, of the things that we deal with are coming front and center to people's minds, which is really good and it's really important, and it puts the spotlight on us as a practice and us as physicians to step up and own it and do the right thing, which is what we try to do, and so it's a nice mixture there, but it says, I mean, the reality is our services are needed in so many places, and kind of closing the loop back to the front end, talking about Appleton and talking about kind of us growing is, I mean, people need our services, and because people need our services, we are figuring out ways to get where people are coming from to come to see us. As we've had people come down to Milwaukee from the Fox Valley since we started the practice 16 years ago. And the nice thing is we're coming closer to them, and we're delivering the same services closer to home for those individuals because they deserve it. And, I guess sort of a shout out to the Fox Valley and Appleton specifically. That's where our initial office up in the Fox Valley is going to be. And, again, for me personally, Gwen, born and raised up in the Fox Valley, we were married up in the Fox Valley. So it's kind of a nice thing to kind of close the loop. So I'd say Appleton gets our shout out. We have, it's been kind of a long time coming, but we're happy to be there and happy to kind of serve you in your home court. So it's good. Any shout outs or thoughts from your?
No, I mean, I'm excited to spend some time there and get to know the people in the community, and hopefully get that office up and going and be successful and reach a lot of people in Appleton. So and the Fox Valley. So.
Absolutely. Fox Valley is where it's at. So yeah, that's all we got. So, thank you all for watching and listening. If you're watching us on YouTube, please subscribe to our channel. If you're listening to us on whatever medium you've got, if you give us a rating, give us a like, give us a shout out, that'd be a nice thing. And always, if there's information that you guys are looking for from us, our website is adventknows.com, and that's where you can find us. So until next time, take care.